It was a 17-year-old girl that is living with a relation who wanted to help them. The girl committed abortion without telling the caregiver. When they now brought the child, all effort, she said she didn't even know any man. And because she said she didn't know any man, you have no right to do the vaginal examination on a virgin. You must use the virgin something. So do you understand? But the pregnancy test, it did, even though it was faint, but because she committed the abortion about 3 weeks ago. So when they were doing it in a local ward, they used what they are doing in Duda, and they were removing the intestine, thinking that do you understand the part of, so they perforated the womb, behind the womb. So they were taking those parts of intestine. So there were pus everywhere. So I was saying, when I was going, I thought it's perforated typhoid. Typhoid can perforate. But I was saying, this one will say that the pregnancy test is positive. This one will say that it's negative. So long as this woman is not stable, I'm taking her in. Only for me to take her in. Behold, there are multiple punctures on the womb. I don't know what the person that did the abortion for him, used. So, that maybe is a sharp something. So it was puncturing the womb. So there was a place it was punctured through and took part of the intestine. Hey. So that was why she was leaking that feces. So what we did was, we first of all tried to do the one we can do. The part of the womb that looks not good, we have to remove that part. But thank God, she might still be able to carry a baby to term. Then we brought the general surgeons, who also joined us to do what? To repair the intestine. And she's doing fine. But because I said I went to start with the last, because I left after a few days, I didn't have the opportunity to go and ask that virgin what happened. But the only thing is that I know that she did very well, they have discharged her, and she's doing one. And then there's another one challenging one that we had. A third-year student in Kaduna. I don't know one of the tertiary students in school. Now, the boy that she messed up with is just also her classmate, who can't do anything. But because she didn't say the truth, unfortunately, maybe in the course of doing the abortion or whatever, I don't know how they affected the womb. So the infection, the womb became gangrenous. That is, the womb is no more alive. So because of that, that's why she has been having that fever and all those things, because only her knows what we don't know whether is it the infection from the contamination of the abortion, or is it there was anything. But the only thing is that when we open up, the womb is black. It cannot be remedied. A girl of 21 years, we remove the womb. We remove the womb. So she can never carry a child again. That's it, at 21, third year. So these are the things. So there are especially we that are in the gynae or obstetrician, you see a lot. You see a lot. Now, this is no longer the time we say that a child needs to be 12 years or 14 years to start seeing menses. Now you see them 12 years, you already know what it is. Could you believe that you bring a child of 8 years to taste something? You see that there is no hymen. It looked like that of my mother. The whole hymen. That's why also men should also be very careful, because the children now can put them into trouble. Do you know that a child of 8 years can carry you, indirectly taking your hand to take it to a place you will not like? Because they have already started with even the people in the same primary school with her. And you, if you are the one that your hormone doesn't have control, she will put. You will put. When she will start naming, she will name you first. And we are gone for that. There is no way they will not bring a child less than 5 years that has blood stain on the pant. At the end, either is the driver that came to pick the child that is fingering the child, or is the house help that is fingering, or the uncle in the school that is fingering the child. So there are a lot of things. So too many things. With regards to emergency, we have seen a lot. And also with regards to challenges when we are doing surgery, sometimes also because of this era of supplement, women are taking rubbish. Fibroid. Fibroid is a very sweet surgery. That it has this capsule, you're supposed to remove it without. But they will take all this rubbish they call their supplement. When you go there, you'll be sweating. Because that supplement they take will now destroy that normal capsule that will help you a good cleavage plate to remove it. You can't again. Because we don't cut fibroid. You don't cut to remove fibroid. You're supposed to, once you make that incision, you enucleate it. You enucleate fibroid, you don't cut, you don't excise fibroid, you enucleate. But when they take that in, it will obliterate everything. So you can't even see, so you have to start cutting. And sometimes, when you cut, the more you're cutting, the more the bleeding. Sometimes you end up losing the whole womb. Sometimes not only losing the womb, you lose the woman. And these are all these nyama things. Hey, no, you don't need to, you will take this one, you will shrink it, you will urinate it, you will do this. Now lie. If you don't want to, if your fibroid doesn't need surgery, it doesn't need surgery. If you don't want to do surgery, please don't take anything that you are taking it to shrink the fibroid, remove the fibroid. No. Because you are the one that will have the complication. Sometimes, because of that thing they take, it will have what we call mutation. It will have carcinogenic changes. And then people will say, naturally on its own, its rate is 0.02% for it to turn into cancer. But because of all these stupid things we are taking now, there are increasing incidence of malignant changes. That is something that it looks like now become malignant. People don't tell the truth. You might even go that you are going to do appendix, only for you to open, you see a ruptured ectopic. There are a lot of things, a lot. So that's why I said, with time, we really need this awareness, advocacy. I think it will also go a long way for people that really want to have a change of heart, and live better. With regards to health, all of us should know that at certain age, there are some health challenges you will never run away from. That's why I always tell people, when you're still very young, that time is your parents that take care of it. Parents shouldn't be quick to turn themselves into doctors. Before somebody goes to the hospital, she must have consumed 3 different types of antibiotics, 3 different types of anti-malaria. So for that time, we must take care of them. Then as a young boy or a young girl, for women, that during our teenage, early, from teen to 20s, your hygiene matters. There are changes that will come. It's not sickness. That's why when you meet the appropriate person, will tell you, my menses used to be 3 days or 4 days, now it's 2. It might be just ordinary simple change. You will now start going and taking stupid drugs. And that drug will be what you'll be suffering from, not that thing. Half knowledge is worse than no knowledge. I hope we know. Because somebody knows, I'm sorry, I don't know. Maybe you meet the person that knows. But the person that have the half don't believe that he has half. She thought that he have the full knowledge. Then, because at this stage, what we normally need most is what? Our hygiene. The problem that normally hover around what? Menses. Menses miss. Menses prolong. Menses do this. Menses is dark. Menses is this. Do you understand? These are the things. And when you understand yourself, it helps you better. Then for men, the only thing you will now start begging them and talking to them, they will start experimenting. They will smoke this, they will smoke that, they will drink this, they will drink that, they will have lung cancer, they will have pneumonia, they will have bronchitis, they will have liver problem from all those nyama things. Then for some of them that are into wayward and all those things, they will have gonorrhea. Now, gonorrhea is not more a problem, but they will not meet the appropriate, because if you meet the appropriate person, now cure it for forever and go. Some of them will now, these are most of the things at that age because they want to experiment. Either they're experimenting with the drugs, they're experimenting with the drinks, so these are the areas, or they are so wayward. Any woman that wears skirts, they want to test and see how it is. So before you know it, all of us should know that HIV is not curable. You manage it for life. Hepatitis B, hepatitis C, these are all the things that you cannot get from eating the food. It must through male to female or inadvertent use of blood and blood products. Then when you finish that one now, you move a little bit up. Some of those women, after doing all this nyama thing, they will destroy themselves. When they marry, they will be looking for whom they will point an accusing finger on. Or it will be the man himself also, he have already finished himself. When he marry, he will be looking for, he will say it's the woman that is the problem. Then after that, when we move in the 40s and in the 50s, and I'm talking about the prostate. Any man at that age must make sure that he's checking his prostate. But the first one is the one we put our finger into the rectum, into the anus, and check the consistency of the prostate. To check for the arrangement. This one, I don't know why I can do it for 100 people, I don't care, and go your way. It's not supposed to cost you anything. It's only when you know and check it and there is anything you can move a step further. Then you do what you call prostate-specific antigen. At least you do it once every year, to be checking it. Because once you're around 45, you're supposed to be start checking. Initially, we say 50 years, but now, once after 40, you should start checking. Then for a woman, if your tummy suddenly started getting bigger, if you have fibroid, you should have known. If it's not causing you bleeding and it's not pressing on your kidney, you don't need to remove it. Don't allow doctors to be deceiving you. Because in a fibroid, there is no woman, African woman, you will not see 1 or 2 fibroids. But the only one that you need to remove is the one that is causing problem. You don't need to remove it. Maybe you want to get pregnant, you see that it's pressing on something like that. That's all. Not all fibroid can be removed. Because when you go into menopause, it will not destroy, degenerate on its own. Then these are the things. Then also, if you start bleeding, suddenly their bleeding looks abnormal, you check. Am I developing cancer of the womb? Am I developing cancer of the ovary? Am I developing cancer of the cervix? And all of us should know that any woman that fled from one woman to the other, the chances of developing cancer of the cervix is high. Even if you're a good person and your husband fled from one place to the other, that's another disadvantage. You are at risk of cancer of the cervix. Because that human papilloma virus you are running away from, after being like this, your husband will go and get it and give you, and you develop it. So these are why this education is very good, so that you also educate the man. If you love me, you have to help me to be alive, so that 2 of us will take care of our children. Then, if you suddenly your tummy started getting bigger, any small thing you eat, you get food, especially those that did not have many children. Some people like Reverend sisters or people that didn't marry on time and all those ones. You think, are you having cancer of the ovary? You must check. Then if it's a man, every time this thing is paining you here, don't say ulcer, it will be cancer of the colon. You must be sure. Or even if it's not cancer, could it be that there is any of dyspepsia, all those, to find out which one it is so that you treat it on time before it becomes bad. So that's why as you're getting on in age, you're checking on. Then by and large, this is the time, mainly at that 40 or 50, this is time you must be checking your blood sugar, your BP, because that's when the BP will start going up. As your estrogen level is going down, that's your menses will be going. Once your menses is going, your BP will be coming up. As also the estrogen come, the endocrinological system will also be affected, especially if you have family history of diabetes or hypertension. Maybe your dad had it or your mom had it, or they didn't even have it, but they have the gene that expresses in them. You can develop it at that time. And if you are not doing checkup, it will be only as emergency they will bring you. By then, it will destroy the organs. But if you're checking and you find out when it develops, you now take care of it before you now have any problem. And all these things are not problems so long as it's discovered on time and taken proper care of. Don't mind what all these people that has their microphone are taking. You see, as you are sitting down here, without even doing anything, you can have staphylococcus aureus. You can have. Reason is that I want to tell you, most often, those people that they say that have the staphylococcus aureus, it's not even staphylococcus. If you are collecting sample to do culture for somebody, and inadvertently your hand, because this hand has organism, inadvertently this hand, any of this hand, touch inside of that container, you contaminate the place. So you'll be culturing what your hand introduced, not what is in the person. And that's why you continue to give the person the drug. The person will now start getting worse because you are giving the drug for what he doesn't have. You see somebody that are feeling something, by the time they start treatment, they get worse. Because they're not treating what they have. You are giving for something they don't have. So if you say Staphylococcus epididymis, there are different types. That one, yes. But that one also can come from contamination as well. Do you understand? It can come from contamination. But mostly, Staphylococcus is not sexually transmitted. It's not.
Well, you can be.
No, it's not. It's not. And most often know that Staphylococcus is nothing. The way God has, don't mind all these things we are saying. Yes, if there is nobody now that will do culture in the East, in the Igbo land, that will not have staph. You must have typhoid, malaria. Then if you do culture, you will have staph. Most often, those so-called staph, it's not even in that specimen they collected from you. Most of the sexually transmitted, it's not in the urine you will see it. It's when you take your swab. It's when you take your swab. And when you take swab, the swab that can cause all this in Yamanyamati now, when you're talking about chlamydia trachomatis, or when enterococcus, all those ones, Escherichia coli, all those ones. Do you understand? All those things are the ones, that's for UTI, that's for urinary tract infection, which mustn't be. It is not doing sexually transmitted. But when you're seeing human papilloma virus, when you're talking about chlamydia, when you're talking about Candida, initially we were saying that it's not sexually transmitted, but it is. Some are not sexually transmitted, but many are also sexually transmitted. I hope we know. Because chlamydia can come if you are dutching. All those women that rub some feminine something to make them smell good. All those, they can develop candida without having it, not through sexual. Yes, because you will not destroy the normal flora of the place. And when you destroy the normal, that's why if you watch, when you dodge, when you use this, you see that every day you'll be discharging, you'll be itching. Ideally, the normal private part of a woman is supposed to be washed only with water. The only thing is that you wash severally to make sure that it's clean. You don't need soap, you don't need Dettol, you don't need Isa. Just water.
In, out, outside.
In, out, everywhere.
Jeez.
Once you make, even if it's after your menses, the only thing is that you need to wash it as often as, until you will feel the neatness when you finish washing it. But this one, they will carry soap, put, carry Dettol, put, carry Isa, put. When they finish, they say it's itching them. Me, if you enter, I say, why won't he itch you? Let it itch you more now. Because that's the normal, you have already destroyed the normal flora there. And once there is alteration in the normal pH of the place, definitely any organism that's not supposed to grow there will not grow. So that's why you don't even go there to distort anything, because once you distort anything can happen. You finish washing it with Dettol, you continue to remove that whitish something that looks like a raw pap, which is candida. And that candida is not because you did that one is not sexually transmitted, that one is because we have distorted the normal flora. Every woman is open. From there, it can enter anywhere you want to enter. It can even from there go and block your tube forever. Yes. Because once you are going in, you reach the mouth of the womb. From the mouth of the womb, you enter the womb. From the womb, you enter the ostium. The ostium goes into the tubes. And from the tubes, the fimbrial end of the tubes. From there, you jump into the peritoneum. Into the abdomen, that is this place. From there, you can reach anywhere you want to reach. You can even from here reach the brain. Of course. Is it not your body? Because once it's in there, it can enter the bloodstream. And if you're unlucky and they block the tube, that's forever and ever. If you like, go to Germany. When you finish going, you come back. The family pressure is much. If 10 sisters left the convent, either they were expelled or they left on their own. 8 or 9 of them were because of the family. They want you to go and steal from the church and bring to them. They want you to go and do something that they know, even if as a lay girl, it's an abomination. They don't care.